Now, the earlier developmental signs are recognized, the greater the opportunity for support and developmental progress. What are those signs that you should look for to know that these are signs that I should be worried of? And if you've got to do support, to do support and intervene at that moment, I'm also going to give you what type of brain system that you're actually helping to improve, because the brain plasticity is at the peak. So I'm going to give you 5 signs. The first sign is speech delay. I've talked a lot about this. If your child cannot make a 2-word sentence at 2 years, that's a very big sign that there might be speech delay. And we will also talk about what parts of the brain that are affected by then, because it's not just about frontal lobe or temporal lobe for understanding and sound processing, but also even cerebellum. So if your child cannot make a 2-word sentence at 2 years, or even have 50 words or 30 words in his vocabulary, this is a sign that your child might have developmental challenges. And the earlier you act, the better. The second sign is also inconsistent response to name. If your child, sometimes he responds to name, sometimes he doesn't respond, sometimes you call him, sometimes he doesn't reply to you, or he doesn't even turn, this is a sign that your child has got developmental challenges and he needs another support. Another sign that you are going to look for is repetitive behaviors. This is one of the things that parents take too long to notice. But when you see your child, he always does the same thing, spinning object, doing this, doing that, over and over again. This is one of the signs that he might have got developmental challenges. And when you see it, when your child is still at 2 years or 3 years, you've got a lot of chances in the world to actually change his life. Now, another thing is delayed coordination and movement. This is especially for children with CP. If your child cannot be able to hold the neck at 3 months, that's a sign that your child might have developmental challenges, cerebellum, motor cortex, basal ganglia. And when you act and get him for support, you can be able to actually improve the 5 multiple systems that I will tell you about, including parietal lobe, sensory integration systems, frontal lobe. So if you see that your child cannot hold the neck at 3 months, and he's not able to sit at 8 months, normally even from 6 months children are able to sit, that's a sign that your child might have cerebral palsy, and the earlier you act, the better. So if you see these signs, and the child also have poor eye contact, those are signs that you as a parent, you should look for. And also if you find he's excessively interested into objects, into especially screens, these are signs that you as a parent, when you act, you can actually be able to improve. But now, why am I saying this? It has increasingly, the developmental neuroscience has increasingly stated that the early childhood, it is the most critical period for intervention because the brain plasticity is at the peak. So as a parent, when you act at that time, there are 5 different systems that are actively adapting, reorganizing, and even strengthening their neural pathways. And among these neural pathways that are being strengthened, adapted, reorganized, you as a parent, when you do all these interventions that I've always kept talking about here, you are going to be able to change your child's life. Because by getting your child for intervention, get him for swimming, get him for praying, get him for kunga therapy, take him for occupational therapy. So you are going to change a lot of things, because if you can't have time with your child to interact with him, to encourage communication, to make some play with him, then you've got someone who can do that for you, an occupational therapist. You've got Kunga therapy, which is now going to improve that body-brain connection. You've got Kunga therapy that is going to improve brain connectivity by improving blood supply to the brain. So these five systems are actively developing new neural networks. They are adapting, they are reorganizing, and they are now strengthening the neural pathways. There is frontal lobe, where you have attention, and also even motor planning is there. So by getting your child for intervention, you are going to strengthen his frontal lobe. And also you are going to strengthen his temporal lobe, where you've got sound processing, language understanding. So if he's not making speech now, but because you just took him for intervention, when the brain plasticity is at the peak, you are going to get a lot of changes. Not just that, his parietal lobe is also actively helping with his spatial processing, and also even with neural integration. So sensory integration, sorry. So if you get him for intervention, all these parts, cerebellum systems, they are actively now involving into reorganizing and adapting the networks in charge of coordination, in charge of organizing speech. Your child might reach 3 years when he's already talking. But now, if you happen to find these signs that I've talked first when your child is 2 years, and you get him for intervention, my friend, you might find all the work you had to do for the next 10 years, you've just done it for the next 8 months or 1 year when your child is 2 years. And afterward, you find your child has actually progressed and covered all the things other kids are doing. So waiting is not the answer. Like many people tell parents, you see, you can wait, you see, it will come, you see, even mine. You are actually not helping by telling that parent that he should wait when he's seeing results, signs which should make him worry. But you are telling him, you should wait, you see, it will come. You are not helping at all. Because brain plasticity, the neurodevelopmental, the developmental neuroscience is showing that the brain plasticity at that time, 2 years, 3 years, 4 years, is at the peak. And that's the critical time to actually get your child for intervention. Yes, the screen may be calming your child, but affecting attention silently. Many parents actually get to see that when you give your child a phone, it actually reduces tantrums and he becomes the happiest. And when you put it away, he becomes aggressive all of a sudden. We all want things which make things easier for us. Of course, you don't want your child always to be crying, always to be throwing tantrums. And of course, it's very understandable. It's one of the questions I'm asked from time to time, whether on phones, whether on calls, whether on messages in my office. Parents keep asking me about what they can do to improve their children's speech, what they can eat, what kind of things they do, where can they take their children, let's say for sport and all that. But when they ask me that, I actually reply them most of the time with this response, don't look at too much into what you can do. Actually, look at what you can reduce. You can reduce screen time. Why am I saying this? During early childhood, developmental neuroscience has shown that the brain plasticity is at the peak. So the 5 systems in our brain are actually adapting, reorganizing, and strengthening our systems, the neural pathways in those systems. Here we're talking about frontal lobe involved in making speech. We're talking about temporal lobe involved in understanding. We are talking about even parietal lobe involved into sensory integration. But we are also talking about the limbic system involved into emotion. You wouldn't want your child in the future to not talk to anyone. You want your child to communicate with others. Guess what? We all learn it from communicating with other people. We didn't know how to talk the language which you grew talking about. We learned it from our siblings, from other people. Now, your child is already vulnerable. His system is vulnerable. But you are exposing it to screen, which takes a lot of neurological energies, and which might end up actually getting the child to shut down completely. First of all, while he's engaging himself with screens, he's not making any communication. And this is affecting not just communication, it is affecting regulation. It is affecting movement because he's not involved into play. His system is already vulnerable. The best you can do is to give him things which are going to contribute to his development, to his progress, not to throwing it down. So also it teaches a point because it is layeristically. You can see when you remove the phone, of course the child is going to cry. And parents say, can I give him the phone at least for 1 hour? But even that 1 hour, let me tell you what is going to make your child lose. First, communication, interaction. By being on screen, he's not going to interact with anyone. He's not going to be talking with other kids, and that's how he can learn language and even how the sensory integration, how we relate with others. If they talk to me, this is how I hear, this is how it goes into my... So there is a way he will be interacting with the outside world. He touches things, he hears, he smells. But when he's actively focused on his phone, he's not doing any of that. The second thing which is going to be affected is the sensory processing by being on screen. By being on screen, your child is not going to be able to hear and train his temporal lobe to process. So if it doesn't process what he's hearing, or is not being trained, because the brain plasticity is at the peak at the moment, and the more he hears, the more sensory processing he gets, it becomes easier for his system to start adapting. So by shutting him in his own room with a screen, you are not helping with any of those which he needs. The second thing which is going to be affected is executive function. What do I mean by this? This happens in the frontal lobe, whereby we memorize, we plan, we do. So our cognitive side of our brain starts now knowing how to answer, how to do things, and how to handle things differently. But when he's engaged with a screen, he's not doing any of those. Instead, that screen, it's like a stealer of his of course it's a stealer of his neurological energy. Let's say, and most of these children, one of the things problem they have very low levels of dopamine. They have low levels of neurological energy. Now, even that small energy he has, it is being taken away from him. You are not helping with anything. The fourth thing which is going to happen is social engagement. You want your child to engage with other kids, to engage with other people, to know how to reply, to know how to smile, to know when someone is angry, this is how I reply to him. But when he's too much into his screen, he's not going to do any of those. So if you ask me, what kind of advice would I give to any parent who wants to improve his child's speech? Before telling him to bring the child here at Kunga Therapy so that we can help the child to improve speech, the first thing I will tell the parent, if you can stop the screen for a month, that will be just fine. You want your child to progress, stop screen. I know it's hard. I know when you put it away, he will cry. I know it might be very difficult for the first week or the second week, but guess what? You'll be helping him. Yeah, sometimes the child is not stubborn, but the nervous system is overwhelmed. What do I mean by this? Many parents ask themselves, and it's one of the things which they don't like about their children, why is my child always overactive? He's overwhelmed. Why is my child always sometimes screaming and screaming and screaming? He's overwhelmed. Why is my child always difficult when you try to transition from this to that? He's overwhelmed. If you understand now what is happening in him, which is making him difficult from transitioning, difficult to him, and he end up even sometimes shutting down, then in some cases, when you see him hyperactive, when you see him screaming, when you see him doing repetitive behaviors, when you see him difficult transitioning, now you start feeling sorry for him instead of blaming him. What is happening? When the children are having this difficult, in most of the time, they are having difficult with emotional regulation. These are the things that take high neurological energy. Even in social interaction, as much as simple we might think it is, but these are one of the things that takes high neurological energy. You are looking at someone, he's talking, you are replying to him, you are processing in your brain, yet the energy you've got is not enough to sustain a 5 minutes or a 2-minute conversation. What do children do? They learn hyperactive. What do children do? They avoid the eye contact. What do children do? They might scream. The more you force him to make a conversation and his nervous system is feeling overwhelmed, he will prefer even shutting down or even going in a certain room and close himself in that room so that he can protect himself. So, if it was you, you would have done the same. And now there is this misunderstanding. On this side, there is parents and siblings and the world outside. On this side, there's a child who is feeling misunderstood. I'm being thought that I'm stubborn, but I'm having it difficult to sustain this conversation because communication is becoming difficult. I'm being asked questions and I'm processing in my temporal lobe. The information has to come in my frontal lobe. I've talked a lot about this here in my book. This is taking a lot of neurological energy for me. So if I sustain a 1-minute conversation, that's what I'm capable of at the moment. The best you can do for me is to accept me and instead do things which can help me to improve myself, to calm my nervous system, so that, first of all, so that in the future I can gain better interaction, so that in the future I can improve my attention. Those are the things you can do for me. What do I need to improve those systems? Because here we are talking about frontal lobe, we are talking about temporal lobe, we are talking about cerebral systems, we are talking about parietal lobe, we are talking about limbic system involved in emotions. So all these systems in the early childhood, they are working together, interconnected systems, working together to do all these things we do: learning, readiness, attention, communication, sensory integration. So all these things we are able to do them because these systems work together to make it a possibility. But for him, his nervous system is already overwhelmed. And being vulnerable, there are some things which he finds it difficult to sustain a conversation. What you want him to do, he's not able to do it at the moment. He might in the future with intervention, with all these things we talk about, the kind of food you can give him, to bring him here at Kunga Therapy so that you can work on him and calm the nervous system. Prevent that overwhelm, to prevent the nervous system from being overwhelmed. And I was telling parents, have you noticed that your child, in most cases, in the mornings, he's more calm and engaged. But as the day goes on, like at 3, at 4, you find he's becoming more hyperactive. So these are things that you can do. If you see him, he's hyperactive, he's choosing to shut down, he's having difficulty in transitioning, he's screaming, doing repetitive movement behaviors, just know that his nervous system is overwhelmed. The best thing you can do is to understand him, give him peace for some moment. Maybe after 2 hours, he'll be able to come back and sustain conversation or anything you want him to engage in. That's why we always recommend, if you are even trying to bring him to talk and have conversation, to teach him to engage with others, when you do it for 2-3 minutes and he kind of try to run away, let him be. Let him be for like 30 minutes, 40 minutes, 1 hour. And when you see him, he has forgotten about it and is a little bit more relaxed, that's when you can bring it again, because by then he'll be having energy to sustain what you want him to do. Now, many parents like to say, my child understands instruction, and he even recognizes people. He can even follow routines, but why is he not speaking? You see, communication is not just being done by one part of the brain. It's not just temporal lobe, it's not just frontal lobe, it's not just cerebellum. There are 5 different systems that work together for a child or even us to be able to speak, to be able to communicate. So if one of these parts is not interacting with the other, the child will not be able to speak. Or even when the brain is not communicating well with the body, like I talked a lot about in this book of mine, why your child understands but doesn't speak, the child will not be able to make speech. But now, understanding all these 5 systems that works together for a child to speak, now you'll be able to understand what your child needs and what kind of intervention you can do to actually improve his speech. What are those types? 5 different types. There is, of course, frontal lobe. This part helps the child to plan the speech. It's also the one holding executive functions. The second part is temporal region. This one will help him to process information to process the language, process the sound, and give meaningful responses to the frontal lobe. So if one of these two parts, the neural networks, they are not wired the way they should be wired or are not adapting, because like we said, when you get your child for intervention at an early age, because of brain plasticity, the brain is reorganizing, is adapting, is strengthening the neural networks. So you can be able to improve your child's speech. Another third part that is involved here, of course, it's cerebellum. Cerebellum systems are involved into making sure that the speech we make is timely. The way my lips keeps opening and closing, this is cerebellum doing its work. Yet, it's not the one actually producing speech. Speech is being produced in my frontal lobe. So, if I ask my child to say this, say that, say this, say that, actually, I might trigger into adapting, which is why you should take your child for intervention, because the more he engages with other people, the more he engages into praise, the more I've talked a lot about involving your child into different sport activities, swimming, how to improve the nervous system and improve interconnectivity between different parts of the brain. So the more you do this, you can be able to help the brain adapt. It's not like when the child does swimming or pray or bring him here to Kunga therapy and we start working on him. It's not that we are going to change the brain, but we are going to help the brain adapt. We are going to help the brain strengthen. We are going to help the brain reorganize. Some kind of intervention are more like intense in the way they are conducted in such a way that they can help the brain to adapt faster, they can help the brain to reorganize faster, they can help the brain to strengthen the neural pathways faster. So it's not like for him to speak, he needs just frontal lobe and, okay, if the child is not speaking up in the frontal lobe, that's the frontal lobe. No. Frontal lobe makes speech, but it's the cerebellum system that actually provide timing and even coordinate speech. The jaw has to be stable, the tongue has to move in the right moment, and even my lips needs to know when to open and when to close. This is done unconsciously. When you are talking, you don't command your mouth that right now close, the next minute open, the next minute close. This is the work of cerebellum. And that's why you should also now start engaging your child. Instead of letting your child be on screen most of the time, that's now why you should now allow him to be with other kids, allow him to be in the middle of other people, engage with him more, encourage him to talk as much as possible, because the more he encourage and he's still young, you can be able to help the brain adapt, reorganize, and strengthen the neural pathways. So another system which is also involved is the limbic system. The limbic system now is the one now in charge of emotions. Okay, this person is angry at me. This person is happy with me. This person is smiling. This person is not smiling. So we are able to read those and interpret because of this part. Communication, when you're communicating with someone, we know when someone is angry. We know when someone is smiling at us. We know when someone likes us. We know when someone is not happy with us. So all these are involved into communication. You wouldn't want your child to be able to spell words, mama, daddy, baba, what, but he doesn't know when someone looks happy or unhappy, when someone looks good to them or when someone looks against them. So you want him, all these 5 systems to be working together. You also don't want him to have speech in his frontal lobe, but cerebellum systems are not now making, timing, and actually coordinating that speech. So speech is not just one part. It's very possible for your child to understand everything, to follow instructions, to even remember routines, to even remember faces, but not be able to make speech. But now when you take him for intervention at an early age, 2 years, let me tell you, if there is one thing that I like to hear, I'm sorry, I have to say it. When I hear a parent saying, my child is 2 years and 4 months, he hasn't been able to make a sentence, so I'm worried and I'm looking for intervention. Guess what? I feel happy in my heart because I know this parent, in just 3, 4 months, 5 months, 6 months, the child is going to start make sentences. As long as you take your child for intervention at that early age, the brain is adapting, the brain is reorganizing, the brain is strengthening the neural pathways, which are in charge in all these 5 systems, even sensory integration. So all these, they are working together to make sure that we as human beings, we can communicate. So any intervention you are going to do at the moment, it is going to yield more results. Many parents notice that their children actually love cartoons and interacting with screens more than actually interacting with other people. When he's with cartoons, he feels more relaxed and you can see he's more happy than when he's interacting with people. Why is that? And when you take away the screen, he excessively becomes aggressive. Why is that? The reason is because these cartoons are predictable for him. They have sensory stimulation for him. They activate the reward systems in him. One of the things that these children with the developmental challenges fight from time to time is sensory overload. Having raw neurological energy. But when he watches something which triggers dopamine, which triggers the reward system to reward him with more energy, and he feels, and even the blood supply at that moment becomes too high because of high dopamines, many children end up finding cartoon more rewarding, more relaxing, and because also they trigger more dopamine release, they find it likable, more engaging, and more lovely than interacting with people. But guess what? As a parent, what should you do? You shouldn't, of course, allow him to engage more with cartoons because that one is going to prevent him from learning the necessary communication, from having emotional regulation, from having body awareness. Because the more he engages into environment, engaging with other people, talking with other people, that's how he learns communication. That's how even he learns how to respond to some emotional processes. So for him to like cartoons more than engaging with other people is because when he's engaging with people, those ones are very complex operations for him. Because they engage frontal lobe, cerebellum, temporal lobe, all these things. Let me put it like this. If you have, let's say you've got a car, a small car. A small car cannot carry a big car, but trucks can. So, but even those trucks, they consume more energy, they consume more petrol compared to small cars. So this is also how our brain operates. If something is going to make me use 5 different systems, I'm talking about the limbic system, the frontal lobe, the cerebellum, the temporal region, even the parietal lobe, and all these are going to be involved And even the body is going to respond, it has to respond well to the instructions. For me to speak and engage, no, this person is happy with me, so I should respond like this. This person is angry with me, so I should respond like this. So all these things takes more neurological energy, and which, for a child who is having an overactive nervous system, he's short on that. So that's why they find themselves more engaged, and they find with cartoon, and they find cartoons more likable to deal with than dealing with human beings. So as caregivers and as parents, should we really commend that? Should we really allow them to continue doing that? Definitely not. Because that one is going to prevent him from having the best time that he needs to get used to sensory processing. It is going to take him the most time he needed with emotional regulation, because at an early childhood, at an early age, the brain plasticity is at the peak. That's a developmental neuroscience. That's what it is saying. And the brain is reorganizing, adapting, and strengthening the neural pathways. So all of these, emotional regulation, communication exchange, all these sensory processing can be worked on by allowing him to engage with other people. There is one simple rule that has always missed many of us, which, dealing with these children, that's one of the things that there is Kunga therapy, of course, which is going to work on your child, and in a few months, the child is going to improve attention, focus, and speech. But some parents are also not able to access that due to distance. Some are not near where the centers are, or some are not even capable of attending them. But there is one thing that you can do. Allow your child to engage. Don't allow him to be on phones. Talk with him often. Allow him to engage with other kids. Guess what? That's also another therapy. Even us, when we are burdened by emotional problems, we go to a psychologist to help us. We go for counseling. And what about the child? Because for them, engaging more with people at that young age, the cerebral is saying, okay, my person, let me put it, my person is being asked to make a reply. So I need to send signals to the mouth. So today, he will not be able to make speech. Tomorrow he might not. Another day he might not. But in 2 months, what do you think? He might be able to speak. Because the brain is learning to adapt. The brain is learning to engage. The brain is starting to reorganize. Oh, okay. So we were wired this way when the child was born, when our person was born. But we are seeing he needs to communicate. So we need to reorganize. We need to work on this thing. Because the mouth has to speak. It has to know when to open. It has to know when to close. The jaw has to be stable. So by allowing your child to communicate, that's the most remedy I can give any parent. Allow your child to... Okay, if you do it for 30 minutes this month, next month, that's okay. But strive to make it for like an hour in the next six months. Try to make it like 3 hours. Try say, I'm going to make sure my child involves and engage with other people more. Like they say like 3 hours or 4 hours in the next 6 months. This is going to be my goal. Make it your goal. Also avoid screen. We always talk about remedies, but we forget to talk about things to avoid. Because screen can destroy all these things. Emotional regulation, sensory processing, communication, all these cannot happen with screens. But now allowing your child to engage with more people, to engage with people, to talk, you yourself praying with him, those are going to actually work on this. So if you ask me what is the best remedy every parent should be doing right now, this is the one. And stopping screens and giving all those types of food that we like to recommend. Also, I've written a lot about on the tips which you can use at home in this book. Your child understand but doesn't speak. So that's the best remedy you can do. Stop screens, encourage more conversation with him and with other kids. Allow him to be out there among people because the brain is adapting. The brain is reorganized. That's what we call by brain plasticity. The brain is strengthening the neural pathways. So this, you have a problem with the frontal lobe. Guess what? You have all the chances in the world. The child is 2 years. The brain plasticity is at the peak. Any engagement he's doing, you don't know how many new neurons are being formed or strengthened or reorganized or adapted at the moment. So give yourself a plan of 4 hours or 5 hours, or you can bring your child here at Kunga Therapy. Then we work on that for you. We do our treatment to improve body-brain connection, and also improve blood supply to the brain, and also improve brain different brain parts connectivity with Kunga Therapy. So if you can't bring him at Kunga Therapy, then stop screens and allow your child to engage with other people more often. If you can't be able, if you find it difficult in the first 2 weeks, 3 weeks, don't worry. Just keep doing it. And if this month you've been doing it for 1 hour every day, make a plan and do it 2 hours next month, every day. Because you've got an insider, let me call it doctor, insider therapist in the brain, which is brain plasticity, which is adapting, reorganizing, and strengthening the neural pathways. So any intervention you are doing now is going to yield more results.